Hey guys, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And you'll have to excuse that. For some reason, my mind blanked a little bit and I forgot what I was going to talk about. But rest assured that I do know what I was going to talk about now. So when you decrease your step rate and you decrease the cadence, you're increasing your stride length. And that's in general when you're maintaining the same speed. Okay, so on the other hand, the other side of that is an increased step rate and an increased cadence is going to decrease your stride length. Hey Dean, sorry about that. So with the increased stride length, and this is a generality because you do see folks with longer stride lengths that are forefoot strikers. But in general, the longer your strides are, the further out your tibia is, the further out your foot is when it strikes. Appreciate that. And it sort of leads into a rear foot strike or a heel strike close to the calcaneus. And while a lot of folks have linked this to an increased risk of injury, something like 80% of runners actually have a rear foot strike. So wouldn't that mean that, almost every runner would have knee pain or have tibial, be in a high risk for tibial stress fractures? I would say probably not. However, this in combination, an increased stride length and a decreased cadence, hey Gail, in combination with other factors like poor rest habits, trying to run high intensity days, too many close together without appropriate rest, poor nutrition. These things in combination, if you're landing heavy, anything that's going to increase the load through those structures is going to increase your risk of having breakdown of those tissues. So I just wanted to get across the point that while it does increase the strain or the stress on those tissues, it does not necessarily mean that you're going to have an injury if you're someone who is a rear foot striker with an increased stride length. So one thing that you might manipulate though, or change if you're a runner who's having knee pain or pain in the like shin splints, is you might try to increase your stride length, or increase your cadence. So increase your step rate, okay? In general, that will decrease your stride length and cause you to strike more with a mid-foot to a forefoot strike pattern, and cause more reliance on the muscles of the calf and the muscles of the foot. So it'll take a little bit of the strain and the stress off of those anterior knee structures. So that might be helpful for someone who's having knee pain or tibial problems. So, and on the flip side of that, if someone is if someone's having trouble with plantar fasciitis or they're recovering from a calf strain, one thing you might do is to increase their stride length. So that would take some of the strain off of those foot muscles and off of the calf muscles, and allow for the tibia and the anterior knee to take a little bit more of the load. So hopefully that makes sense. I know I kind of fumbled around there that first attempt, but I think we got it now. So if anybody has any questions, please feel free to reach out. Once again, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness and the founder of this running injury support group. So hope everybody has a good night and take care.